Welcome to another episode of eHealth Matters podcast. My name is Aisana and I'm the clinical lead for eSurgery. Today, I'm joined by my colleague, our superintendent pharmacist, Justin. Welcome back, Justin.
Thank you, Aisana. Lovely to be here again.
Lovely to have you here. And today, you're going to talk to our audience about Pharmacy First services.
That is correct, yes.
Amazing, lovely. So let's start with the basics. What is Pharmacy First and why has the NHS introduced this service?
Okay, yeah. So Pharmacy First, it was introduced in January 2024. It was a means of patients being able to access treatments much easier than they are at the moment. So there are 7 common conditions that they can come into the pharmacy. Mm-hmm. They can be assessed and then they can get treatment from the pharmacist, whether that be antibiotics or whether it just be self-care advice.
Amazing.
Just to relieve a bit of pressure really on the GPs and give them a chance to do more important things.
That actually sounds really promising. I know the struggles that GP surgeries have with seeing acute conditions of patients that need immediate help with conditions like if they have an infection. And it also kind of allows more accessibility to healthcare services by patients as well. So amazing, sounds very promising. And what specific conditions can patients get help under this Pharmacy First? You mentioned there's 7 conditions, but what are the specifics of them?
So if I list them for you, so we've got shingles, sinusitis, sore throat, then you have impetigo, infected insect bites, urinary tract infections, and earache.
Oh my God.
Hopefully I remembered all 7.
You have indeed, absolutely. So there's quite a lot of acute conditions, and I keep referring with the acute condition. That just means for our audience, in terms of acute, it happens immediately.
Exactly.
Right? Okay.
Exactly. So it's not a treatment of a chronic condition, which the GPs will still deal with. It's just an immediate treatment of an acute condition,
Amazing. And we will talk about the specifics of these conditions in just a moment, but I just want to just dive into a little bit more how this is benefiting our patients and our NHS system, and what was the reasons that they introduced this service?
Sure. As I said previously, it's to take pressure off the GP, but it's for the patient. It's much easier access to services. So whereas before, I mean, we've all experienced trying to get a GP appointment, which isn't easy. And now the patient can turn up to a pharmacy and have immediate treatment for an acute condition. So accessibility, the speed of service, and also the hours that the pharmacy will be open. You're not restricted to going in at certain times. You can go in whenever you want during the day, Monday to probably all week, actually, not just 5 days a week, 7 days a week. And you can receive this service from the pharmacist.
That's amazing. And as you mentioned, with the longer opening hours of the pharmacy, that is very, I suppose, suitable for people who work longer hours. They do shift works as well. You've got the pharmacies that are open till midnight in certain areas of the country as well. So, and also we've got online pharmacies as well to mention as well.
And the service also benefits the pharmacy and the pharmacist because we're all highly trained. And I think we'll all admit that we don't really use that knowledge as much as we would like to.
In terms of patient accessing this service through local community pharmacies or through online pharmacies, what does that look like?
So a patient will present with a symptom. So they will turn up at the pharmacy, speak to the pharmacist. He will likely take them into a consultation room. There'll be lots of questions asked regarding the condition, regarding their medication, their history. And from that consultation, a decision will be made. Now, obviously, every pharmacist will have a different approach. You may get a different decision depending on what pharmacist you see, but they'll all be working on the same, what they call a PGD. So they'll all have the same criteria that the patient must meet before they will offer treatment.
I see. And these are the criteria that's set by the NHS.
Exactly.
Okay. So it's the do's and the don'ts, basically.
Yeah. So, in my experience, some patients get a little bit upset by the fact that you're not offering them treatment because they don't fall within this criteria, but there are strict criteria that need to be met. So of course, that's why.
Okay. And just to make it a little bit more clear for our audience as well, when you say the criteria, so as a result of seeing patients meeting these criteria, there will be prescribed medication that require prescription.
Yes, correct.
And pharmacists are not, pharmacists within your local community pharmacy are not necessarily a prescribing pharmacist.
Exactly.
Okay.
Exactly that.
And that's where it's difficult for patients to understand is that why they can't have something else.
Yes, true. Very true. Yeah. Okay. So they have to stick within within those limits, really.
I see. Yeah. Okay, that makes sense as well. How does this work through online pharmacies then?
Yeah, so with online pharmacies, it's slightly different. You still have to go through that consultation process, but that will be done via a consultation online, which they fill in. So they fill it in from the comfort of their own home. That consultation will come through to the pharmacy, the online pharmacy. The pharmacist will then assess that consultation. And from there, he may then, or she may require a video consultation with the patient. If treatment is going to be offered, this will always be done. The video consultation will always be done with the patient. But that, again, will be done within a private consultation room. So the confidentiality will still be there. Once this consultation takes place, then a decision again is made, and then the patient's medication, if it's deemed necessary, will be posted out to the patient. It's a similar process. It's just there are a couple of little differences there.
Of course. And you're within the comfort of your own home. So this is, I'm assuming, is very useful for patients who live in remote areas that don't have access to their GP. They have to drive miles to the nearest pharmacy, so they can literally just wait for the post to arrive with their medication.
Very true. They don't have to move out of their own home. I mean, the consultation, the video consultation takes place on a phone, a laptop, something that they have available. So there's no need for them to move out their own home.
Amazing. With the online pharmacy, do they, such as our online pharmacy, are all the 7 condition treatments offered?
Only 6 of the 7. So the only one we can't treat online is earache.
Okay, why is that?
Because earache, that necessitates an examination with what they call an otoscope, where you have to look into the patient's ear.
Right.
And obviously that isn't
possible.
Can't
do it through video.
Can't do it through your TV screen, really. So no,
absolutely.
That's the only condition that isn't available.
Okay. I mean, there's still
6.
Still 6
more,
is great.
Yeah,
absolutely. Okay. And are there any kind of restrictions on who can use the Pharmacy First service? So that's all the don'ts, right? On that document that you mentioned.
Yeah. So within each condition, there'll be certain exclusions, let's say. So, for example, if you have a urinary tract infection, you have a water infection, and you are a male, then that will exclude you from treatment. That is only available to females, and it is only available to adult patients as well.
Right.
So that's the sort of thing that will apply in each different condition. There's different criteria for each condition.
Okay. I really want to ask you more questions about this, but I feel like we're going to cover this at the end of this.
I'm sure we will.
So I'm just going to briefly skip through this because I have lots of questions about. I mean, we don't want to come across that we're only, the service is only for a specific gender. There are clinical reasons behind it.
Yeah, exactly.
And how does the information from these consultation done, whether it's online pharmacy or within your local pharmacy, how are these shared with the patient's GP?
Yeah, sure. So when the consultation takes place, as I say, it takes place in a consultation room. The pharmacist will then have a specific portal where all this information is added. So the patient detail will be added, the details of the consultation, whether any advice has been given, whether any medication has also been given, and that is added to this particular portal. When that is submitted, that actually goes through to the patient's GP, because the GP has to be entered into the consultation as well, the details of the GP practice. And so all those details will be sent to the GP. So in other words, all the information that you've given, the medication you've given, will then appear onto that patient's records. So that's great that both aspects are communicating, because obviously, I'm sure you've experienced where one department doesn't speak to another department. But this process actually is quite seamless in that everything you do and everything you enter will go straight through to the GP practice.
Amazing. They don't have to wait for letters to come through.
Exactly. It's all done through,
electronically.
Electronically.
That's really good. And it also, I suppose, safeguards patients in a way that, let's say, if they have the treatment, their symptoms don't get better, and they do end up going back to their GP. The GP has a clear kind of history of what the patient's consultation was with the pharmacist.
True, because they don't rely on the patient to tell them what treatment they've had. They can see it all there.
Yeah, absolutely.
And that when that is submitted, that is immediately sent through to the GP practice. So there's no delay in that information.
Okay. Actually, I have another question. In terms of, let's say you have the consultation with the patient and they don't tick all the boxes to have an antibiotic treatment. Would the GP still be notified that they've had this consultation, or they've had these symptoms that they're presented in a pharmacy?
They would, if the video consultation has taken place and then the decision is made not to treat, but to maybe give self-care advice, maybe recommend, for instance, sore throat. Let's recommend some pastils or some pain relief.
Yeah.
That information is still sent to the GP.
I see.
So they will understand that the patient's had a consultation, no antibiotics were issued. But the patient is encouraged to go back to the GP if those symptoms don't alleviate. So if they still have those symptoms 5 to 7 days later, they're encouraged to go back to the GP.
Absolutely, just so to follow up if they require any further treatment.
Yeah.
Okay. And are there any common misconceptions about Pharmacy First service that perhaps you've come across on your day-to-day practice?
It's not a service that's going to replace your GP. It's just a service. It's an add-on. It's a service that is there just to relieve the pressure on the GP practice. It's not a replacement for that.
Yeah.
A misconception is that also is from a patient's point of view that if the service is available, they expect treatment to be given every time. But obviously that isn't the case, as we've talked about and as we've explained.
Yeah.
It is dependent on a lot of different things.
Yeah.
But again, just to mention, the pharmacist is very well trained.
Yeah.
And he's able to understand the conditions. Even if you're not getting treatment, the pharmacist is going to be the best person to signpost you. So whether you need to see a GP, whether you need to go to A&E, whether you need just self-care and treatment yourself, that's the best place to be.
It's almost like a triage system, right?
Yeah.
So you go to your pharmacist and they tell you what's the next step.
Yeah, that's right. That's right. Yeah. I don't know whether we mentioned it then, and the consultation is all free as well.
Okay.
So if you pay for your prescriptions, you will pay for treatment if treatment is offered.
Okay.
If you are exempt, again, as you would a normal prescription, it will not be paid for.
Okay. It sounds all amazing to me because it just makes sense. Benefit for the patient. You can access the treatment very, very quickly. And in terms of the cost of it, there is no changes. Same as you would go and see your GP.
Exactly. Yeah. Okay. And as you say, it's accessible whether you come through our portal, whether online,
of course,
or through your local community pharmacy.
Yeah. Okay. Oh, well, I'm glad you mentioned that. So online pharmacy is the same rules as well with payment.
Same rules.
Okay. Awesome. Also wanted to double check. So are all the pharmacists that work in community pharmacy trained to deliver this service?
I wouldn't like to say all of them,
Yeah.
but I would say the vast majority. I think you'd be unlucky not to go into your pharmacy and not be offered the service. Yeah. And I'm sure if you're not offered the service, there'll be a pharmacy very close by that will offer the service because it's going to benefit them.
Of course, so they can still signpost you to the near pharmacist.
That's right.
I have actually been in this situation where I've worked in a pharmacy where one of the pharmacists, they just didn't feel comfortable offering the earache service.
Okay.
So they would do 6 out of the 7 conditions, but they just didn't feel like, so that is within the pharmacist's own kind of understanding to say where they draw the line that I don't actually feel quite, I don't want to say qualified because I'm sure, the clinical knowledge there, but they don't feel comfortable perhaps looking in a patient's ear.
Yeah. And I think I would feel the same because I think if I worked because I work online, but if I worked in a community pharmacy and I was presented with an earache, I don't think I'd be competent to, firstly, I've never used an otoscope before, so I wouldn't be happy to use one if I didn't know what I was looking for. So no, I'd be the same as yourself. I wouldn't be comfortable with that.
So I suppose my message would be, don't get disheartened. As Justin said, there will be another pharmacy that they can signpost you to.
Of course, because I would say that it's just a way of life, isn't it? If one pharmacy isn't doing it, the other one is definitely going to be doing it purely because they want to see the patient.
Absolutely, absolutely. So going back to the 7 conditions that you mentioned, let's just get into them a little bit more as well. So let's start with sinusitis. So what are the key symptoms that differentiates between sinusitis and a common cold? And have you had any patients recently that they've come to you and...
It happens a lot. People have symptoms and a lot of them do cross over with a common cold. So they'll have a runny nose, they'll have maybe a blocked nose, they'll feel a little bit under the weather and they're aware of the service and they think, well, I need antibiotics. That's natural progression. I'll go to the pharmacy. But obviously there's lots of things that we're looking for. So maybe there's a little bit of fever as well with the pain. You'll get pain in your sinuses. You get maybe pain in the jaw as well, in the jawbone. So there's lots of other things to look out for. Maybe you've got some discharge, nasal discharge. And you have to have an array of symptoms rather than just one particular symptom
Yeah.
to qualify for treatment as well. So
Yeah.
there's a little bit more to it than that.
Absolutely.
But you'll be questioned by the pharmacist.
Yeah.
They'll delve a bit deeper into you.
I'm wondering whether there will be an influx of patients referring for sinusitis with the hay fever season coming up.
Well, again,
they get runny discharge. Runny discharge.
Similar, aren't they?
Yeah, absolutely. And it kind of, I mean, it's really, really important, I suppose, to distinguish between viral and bacterial,
exactly,
which applies to most of our conditions that we're going to talk about, right?
Yeah, and the duration of the symptoms is quite important to find out how long a lot of people present within 1 or 2 days of the symptoms occurring, and it's a little bit too soon to diagnose somebody.
Okay.
So you can actually give them advice and ask them to come back to you.
Yeah.
So you can still offer the Pharmacy First service, but I wouldn't do that initially. You'd get them to come back maybe a few days later to see how the condition has progressed.
Yeah. Okay. And I'm assuming that you would advise them with over-the-counter medications, or just if it's a sinusitis.
Yeah. So
rinse.
you might give some sinus rinse. I mean, if it goes beyond that, you might recommend some steroid nasal spray.
Yeah.
That usually will treat the condition.
Yeah.
If it didn't treat the condition, you could go beyond that and go to antibiotics.
I see.
But it's kind of a shared decision as well with the patient. Yeah. They might have suffered this treatment, suffered these symptoms before. They've tried a nasal spray before. They've tried the steroid nasal spray and they said it didn't suit them. Yeah. Antibiotics maybe would be the best way to go.
Of course, yeah, that makes sense. Whilst we're on the antibiotic subject as well, there is a big initiative in the NHS about antibiotic stewardship. So, and by that, can you just explain a little bit more? Because I suppose it does apply to this.
It applies, definitely applies to this, because you have to be very careful. We don't want to be dishing out antibiotics unnecessarily, because obviously we've all heard of resistance. We don't want to get 5-10 years down the line where there is resistance built up to many, many antibiotics, and treatments that we can offer are no longer effective. Mm-hmm. So we have to be a little bit careful about how frequently we dispense these for people or prescribe these for people.
Yeah, and I suppose that's one of the exclusion criteria. Is that right?
Yeah, if somebody has a recurrent infection, so they've had this infection maybe several times, then again that will exclude them from this treatment.
Yeah, and in terms of sore throat as well, so I personally get a lot of this through online pharmacy as well. I'm sure you do as well. Yeah. So with sore throat, it's not any old common sore throat. You wake up and you got a bit of a tickle and a sore throat. No. What is it exactly that you're looking for?
So I think this is sometimes a physical examination to see see the tonsils, see what's on the tonsils, see whether there's any discharge from the tonsil, any pus, as they say, any white marks. Again, duration of symptoms as well is quite important with that one.
Okay.
Fever, other symptoms that come with it.
Yeah.
As we both know, they're quite self-limiting anyway, sore throat.
Absolutely,
so it can last 5 to 7 days of sore throat, but then it's gone. And in most instances, antibiotics aren't really applicable. Yeah.
Okay. That makes sense, because sore throat can be extremely painful. It's not to say that we're saying you're not in enough pain to have antibiotics. No. It's just that most of that pain is probably due to a viral infection rather than a bacterial.
And we would encourage people to self-care, so to use lozenges, to use pain relief, because generally that will be enough to treat the symptoms.
Yeah, of course. Yeah, I mean, my good old method is always gargle with salt water. I love that.
Yeah, exactly.
Probably the best method ever. But we're not going to get into the self-care stuff, because I'd much rather do self-care than go through the antibiotic route where possible. So with the earache as well, is there, you briefly mentioned that it requires an examination. Are there age limits for, we didn't really say about sinusitis and sore throat.
Age limit for the earache is just for children. The service is just for children. So I think it's 1 to 17-year-olds. Okay. Again, it's not something that we offer as an online pharmacy, but you can get it from your local community pharmacy. But they do have to have that equipment to look into your ear, to examine you. That's really important, especially for children, treating children. So
absolutely. I'm sure you have children. You'll probably remember the days between 2 to 4 years old, which is I remember from my time, it was back-to-back ear infections from my son.
Exactly.
Yeah. So that would have helped 10 years ago, possibly. It would have helped. Yeah, absolutely. And one of the more common, I suppose, coming up, because of the hay fever season, summer's coming up, is insect bites.
Yeah, I expect there'll be a little bit of a spike in that treatment.
Of course, yeah. So tell us more about this. So it's not just if you've just been bitten by mosquitoes, they have to be infected.
They have to be infected, and they will have signs of infection. There'll be a lot of redness. There'll be a lot of swelling around it.
Yeah.
If it gets to that point, then you can recommend topical antihistamine creams.
Yeah.
You can recommend steroid creams as well. It's only if that progresses, you may get some discharge from the center of the bite as well, in which case antibiotics may be necessary. Mm-hmm. You can offer topical antibiotics or cream.
Yeah.
If you feel that maybe wouldn't treat it very well, then you can go to the antibiotic route as well. So penicillin type antibiotic would treat it.
Okay. And with the, I have seen some very severe cases that are coming into a pharmacy where they've just left the insect bite and it's just got so infected that it's turned into cellulitis. Yeah. Services such as this really do help patients because you can act on it immediately.
Yeah, you don't want to get to that point, do you really? Yeah. So you can treat it before the patient gets to that point. I mean, I don't know about you, but I'm one that when I get bitten, I do tend to suffer quite badly. Yeah. So antibiotics I've had several times for bites.
Okay.
So you tend to find that a patient, if they suffer that way, they tend to suffer regularly in that respect.
Yeah, that makes sense. Yeah. I also wanted to kind of touch upon when you go into your local pharmacy, you usually your first point of service is your healthcare advisors or the kind of the staff members that are behind the counter, and they have been trained exceptionally to identify patients that could be eligible for Pharmacy First as well.
That's exactly right. Yeah, we didn't actually mention that, which is a really good point.
Yeah.
It's not just the pharmacist that will recommend treatments and will signpost people. As you say, they're trained to recognise these symptoms that people present with, and they can be another triage in effect.
Of course.
So before that patient gets to the pharmacist.
Yeah, absolutely. So I just remembered there's so many situations where a patient had for example, an insect bite, and they just come in for some antihistamine, and as soon as the healthcare assistants, they kind of look at it and they're like, I'll go and get the pharmacist, thank you, because that's infected.
Yeah, and you've said that, and it just reminds me that we're talking about the Pharmacy First service, but we're not talking about patients that are going to come in and specifically ask for the Pharmacy First service.
Yeah.
It's a service that's there for the pharmacy. So if you do get that patient in with an insect bite that's infected, they may not be aware of the service, but it's just something that's available to you, so you can use it to their benefit.
Absolutely. And I suppose that's the point of our podcast, right? Yeah. To raise awareness. I speak to so many other mums at school, friends, or dads, and they're not aware of the service because obviously when you attend all these school children, there's lots of illnesses going on. Yeah. And I always tell them, have you heard of Pharmacy First? Go to your local pharmacy, because it is really, really helpful. That's right. That always had positive feedback, and now that we offer it through online resources, that's even better. Right, so the next condition is impetigo.
Yeah.
Okay. I'll put my hands up. I struggle with this service.
Okay.
Tell me more. Maybe I can feel a little bit more competent on this.
Yeah, it's something that obviously visually you're going to have to look at. It's difficult when somebody's describing something without seeing it visually.
So what is impetigo for our audience?
So it's a bacterial infection. Mm-hmm. It tends to be on the face, doesn't it, usually?
Yeah.
And you will get lesions on your face. There may be one, maybe multiple, if it's left untreated.
Yeah.
But yeah, without showing you pictures of it, it's quite difficult to explain. But
of course,
a bacterial infection, very contagious. So hygiene is very important. So if you're using, for example, a towel when you're wiping your face, that towel must not be used for somebody else because it's a very contagious condition.
Yeah. Okay.
But again, treatment is
it's very common in children as well.
Very common in children. Yeah.
The school emails that comes through and they're like, someone's had the impetigo, and everyone just panics.
Yeah. And if one child gets it, there's probably going to be multiple children.
Of course. I suppose the reason why I struggle with it is that children can have many different skin conditions that are quite acute. And with impetigo, it can be overlapping symptoms with other kind of more serious conditions as well. So it is really important. If you have any concerns about skin changes, lesions developing in young children, please refer to your pharmacist.
They will recognise hopefully the symptoms of it. And the particular type of rash that it is.
What would the treatment option be? So I'm assuming because it's for children as well as adults, they can't swallow tablets, capsules. Would they still be able to get the lovely antibiotic liquid?
Lovely banana liquid, yeah, of course they would. No, that is available for them to use,
Okay.
They can use topical antibiotics as well if maybe if there's only one small area that they need treating, they can use a topical antibiotic.
Okay. And you mentioned that it usually shows up on your face. Could it be anywhere else in the body as well? Or is it just limited to the face region?
No, that can occur everywhere on you.
It can
or anywhere on your body.
Anywhere, okay. It is less likely, I suppose.
Less likely,
but usually on the face as well. Another one of my not favorites is shingles. Again, skin conditions.
Me too, me too.
Shingles, right. So whenever I hear shingles, I'm thinking granddad, grandma, they've
tend to be a little bit older, don't they?
Yeah. Tell me more about the shingles condition.
Again, that's a really difficult one unless you've seen the rash and you've seen it on several occasions, so you recognise it. It's certainly a rash that you would look at and think maybe that's itchy, but it shouldn't be. With shingles, there's more pain involved. There's more tingly pain involved with the shingles rash. It tends to be unilateral on the body, so rather than on both sides, it's just on one side of your body.
Of course.
Patients usually feel quite unwell with this, quite feverish sometimes as well.
Of course,
and as you said, it tends to be in the
older
people of my age and older, probably. I would say,
So that's definitely don't associate it with chickenpox because usually with chickenpox you're thinking itchy skin, itchy spots. This is very much different.
It's quite painful to the touch. But it does if you don't ask questions and you just look at it, you could quite easily mistake it for something else.
And for shingles, what is the treatment for it?
So treatment antivirals.
Okay.
Yeah. So a week's worth of antivirals usually does the job.
I see. Okay.
Yeah, and obviously pain relief as well. You would recommend some pain relief for the patient because they're going to be in pain.
I see.
Generally.
Okay. So we've got 6 conditions, which is antibiotics, and then we've got shingles, which is the antiviral.
Exactly.
Okay.
Antiviral.
So that we've been talking about. If it's a virus, you can't have it. But the shingles, you can actually have treatment for it. That's the only condition. Right. Let's move on to our last condition, which is urine infection. And we discussed that this is specifically for female patients.
Only,
Okay. So tell me more about that.
So the specific symptoms you're looking for some cloudy urine, maybe frequency of going to the toilet at night, if that's not normal for you and you're going more frequently at night. And also you're going to get some pain and some burning sensation when you go to the toilet.
I see.
So they're the main symptoms that you're looking for. You're also trying to exclude some patients that have possibly kidney problems. So they're going to have pain in the kidneys. They're going to be quite feverish with it as well. And those sort of things are going to need referral.
I see.
So we wouldn't be offering treatment to that sort of patient.
I see. Okay. And just remind me, we discussed it's specific to females. Why is it not offered to male patients?
Anatomically, it's quite difficult to treat a male with a UTI without going into the anatomy of it. Male UTIs are very much more difficult to treat, and a treatment that we offer for females would probably not be adequate for a male, so they would need further investigation from their GP. Not to say they can't come and see us as pharmacists. We can refer them. So I wouldn't discourage people who have those symptoms from coming in, but they would be referred.
So they essentially need to be seen and also provide the urine sample for further analysis.
That's right.
Okay, that's really, really helpful. Is there any specific condition that's your favorite to treat in community pharmacy?
No, I don't have any favourites.
No, or the one that you really dislike.
The most common one is UTI, I find. But as you've said, during the summertime, I'm sure the infected bites will will spike,
especially if you're out in the countryside.
Yeah. And I think what I've noticed is that the sinusitis and the sore throat, they're the ones that can be mistaken for just the common cold, and people tend to exaggerate maybe sometimes the symptoms. So I would encourage patients always to be honest when they're answering their consultations and answering questions that they're asked, because it's very important to get the right treatment.
Absolutely. It safeguards the patient themselves and also the pharmacist as well, because we're relying on patients' answers being truthful, especially when they complete an online consultation as well.
That's right.
Okay. Do you have any advice for patients considering Pharmacy First service?
I'd encourage everybody to use the service, because, as I said earlier, it's not about getting treatment. It's about getting some advice. Whether treatment is necessary, it may well be necessary, but if it isn't, you're going to get the best advice from your pharmacist.
Yeah.
As we've said, they're highly trained. They know their stuff.
Yeah.
And they'll be able to signpost you.
Of course.
So know that even if you're not going to be offered the Pharmacy First service, I would encourage you to contact your pharmacy.
Yeah, absolutely. It definitely saves you ringing your GP for half an hour. Yeah, absolutely. I mean, we love the work that they do, GP services, but this has definitely been a big step in relieving some of the workload for them, hasn't it?
Yeah, that's right.
Amazing. Thank you for sharing this valuable information about Pharmacy First service.
Pleasure.
And I hope we've raised awareness about this initiative introduced by the NHS. I know that as pharmacists, we absolutely love this because it empowers us to actually do something when patients come into pharmacy. I personally felt quite useless, really, I should say. If someone comes to you, you know exactly what they need, but you couldn't offer it to them.
It happens so much, doesn't it? You know exactly what the treatment should be, you know exactly how this patient should be treated, but you can't do it.
Absolutely. And now we have the power. We have the power. Thank you so much for joining us. Thank you, Justin, and we'll see you on our next episode.
Thank you.